I was in so much pain.
I just didn't feel myself.
Implants are proven to be safe.
Joint pain, reoccurring infections, fatigue.
Remember, this is going to be the last time that you breathe the way you do.
It's a dangerous procedure.
I could hear my body screaming at me.
I couldn't even rock my baby. I would have to sit on the floor and rock him to sleep.
All the implants that are proven in the US are FDA approved.
Honestly, it was the best life decision I've ever made.
Just within a week, you literally changed my life.
Dr. Matteo Vigo is a leading plastic surgeon in Dubai with over 20 years of experience in breast augmentation and cosmetic surgeries.
He is also one of the first UAE licensed surgeons to perform Mia Femtech, a minimally invasive breast enhancement procedure that delivers natural results with minimal scarring in less than 15 minutes.
Dr. Matteo Vigo, where precision, expertise, and care come together to create life-changing transformations with natural, lasting results.
Hello everyone and welcome to another episode of Beauty Talks by Dr. Matteo Vigo. Today we are diving into a very interesting topic, which is the breast implant illness. It's called BII. This situation happens to some women who had previously implanted breast implants in their breast, and after a period of time that can be a few months up to few years, they can develop some symptoms that has been related to the breast implant itself. Even though scientifically the medical community has studied this phenomenon and didn't find a direct correlation between the breast implant itself and the symptoms related by the patients, we have seen that a lot of them are referring to us in order to understand why they develop these symptoms and what they can do to improve their health situation. So today I am very happy to have two fantastic women with me that have been my patients and they've gone through an explantation of the implants, and they are here to share their story with us in order to give a little bit of insight and feedback on what was their journey. So thank you so much, Katrina and Katie, to be here with me.
Thank you for having us.
It's a real pleasure. And you've been two heroes in my practice because you've been really brave in what you've done, and you came with a clear idea of what was needed. And, we follow the right pathway in order to give you back your health and your happiness.
Oh, bless
Absolutely.
you. That's so kind.
So
Well, we
let's
love
dive
you
in.
too.
Let's check what was your journey. So Katrina, tell me a little bit, what was your first idea? When did you put your breast implant? Why did you do that? And what was driving you to get the implant done in the first place?
Okay, so mine, I decided to get them about 9 years ago, and I really regret it, to be honest. And I feel I did it a little bit out of greed because I actually already had quite nice breasts, and I just thought, maybe they'll look better if they're a bit bigger. And actually, from the moment that I had them in, I never really felt right. And I also didn't like them aesthetically. I had the capsular contractor, so my body had actually pushed them away. So they were quite saggy and they were too big, and they always made me feel a little bit bigger and not really myself. So
maybe you were following a trend at the time?
Yeah, a little bit. And you just would never question it. Why would you ever question that it could not be safe for your body? So I just went with it, but it was quite soon afterwards that I noticed that I didn't really feel right.
Okay. And Katie, what was your story? Why did you decide to put the implant? You did more years back than her.
Mine was 14 years ago, and I was in my 20s. I had them first done when I was 24, and then I had that lot out and had implants put back in and lifted. And to be honest, I had quite small breasts and just wanted to feel more voluptuous because I had quite a wide bum and wanted that more fullness above. Yeah.
Okay. And Katrina, when was the first time you heard about breast implant illness, and how did you discover about that?
Well, I actually heard about it from my friend that was really suffering, and she had also done her implants in Thailand, the same as me, same procedure. It was through the armpit, and she was having really bad vitiligo, like standing up. She felt like she was constantly on a boat, and just chronic fatigue, felt really, really bad. And she got them removed. And at the time I thought, it sort of opened my curiosity about it, but I wasn't feeling as horrendous as I began to feel a few years after. And that was when I revisited it and re-looked into it. And I also didn't quite understand that. I thought that maybe you had to have a rupture or something for you to have these symptoms. So I went and got mine checked. They were like, oh, it all looks fine. So I kind of parked it and thought, okay, maybe it's something else why I'm feeling this bad. But my friend, she felt instantly better the week that she had them removed. And she kept kind of reminding me to join the Facebook page, have a little look. And then it was when I finally joined this Facebook page and started typing in my symptoms that I was like, oh my God, I really think this is it.
Yeah. And what about you, Katie? When was the moment you realized that maybe this was related to your breast implant or your health problem?
Yeah, it was a year in after being on the medication and being told that I had autoimmune. One of my clients, which is a good friend of Kat's, I just happened to say, how is Kat? And she said she's had her breast implants removed. And I didn't know anything about Bill then. And that's when she explained to me, and Kat then forwarded me all the information. And I just started researching myself, and very similar to you, started putting all my symptoms in. And I probably researched it for like 4 months, just myself, didn't express to anybody what I was doing. And then just after that time in my heart, I just thought, I think this could be the reason.
Okay. So let's dig a little bit into what are the symptoms that you were experiencing?
So my list was very long, but to run over it quite quickly, it was like joint pain, reoccurring infections, fatigue, like anxiety, rosacea on my skin. I was constantly getting sick. I just felt so run down. I just didn't feel myself. So many things, like I couldn't do things in yoga. I couldn't put my hands flat. And then it was so weird because instantly after the explant, I went into my class and my hands went flat on the mat. Never gone flat before. So it was a lot in my joints, a lot of like muscle weakness, like pain. I thought it was my thyroid. I had hormonal issues.
But you were not diagnosed of anything officially by a doctor, right? It was just your symptoms.
No, yeah. So I kept going to the doctor after I had had my daughter, like knowing there was something not right, and no one could find anything. We tested all my bloods, we tested thyroid, hormones, everything. I had PCOS as well, so I thought, oh, maybe that's contributing to it. But since having the explant, it's real proof to me because everything has gone. So...
yeah,
even the PCOS symptoms. I scanned my cysts 2 weeks before the explant. I had over 30 cysts on each side. I've just scanned last week, and I have like 2 on each side. So I think the implants relate a lot to like hormonal issues, and it can set a lot of triggers off in your body.
Yeah.
Depending on your body, whether your body can handle them.
It's very important that we deliver the right message to the people, because I'm doing a lot of implantation every day. Today, after this podcast, I'm going to have 2 surgeries for implantation, because implants are safe generically, okay? But in some women can trigger something else because they can respond. A lot of questions from the patients is, what if I reject the implant? What if my body rejects the implant? There is not a real rejection, but is a constant reaction to the implant itself through the capsula, because this may be for our audience. When I put an implant in the breast, there always a formation of a very thin capsula, and 99% of the women have this capsule very thin. We know it's there, but we don't care because it's not an issue. In some women, like these 2 ladies here, and also a lot of other patients, the capsule becomes thicker and creates this contraction around the implants that can cause, first of all, local symptoms. So you have pain, discomfort, they are hard, the movement is not feel right. But in most of the patients, this doesn't happen. So it's very important that this podcast is to create awareness of the breast implant, but not demonizing the implants, because the implants is safe. I remove implants after 25 years. Just for an aesthetic improvement, because the patient is absolutely fine. So it is very important also these details. But going back to the symptoms, Katie, you told me that you've been diagnosed with an autoimmune disease, right?
Yes.
What was it?
So I had rheumatoid arthritis. So I had my little boy, and about 3 months later, I started with a urine infection and chronic pain from my waist down, almost like a stabbing pain, and severe fatigue, brain fog, depression, which obviously having a baby, you put it down to all of this. So in January, I eventually went to see a doctor, and they diagnosed me with autoimmune. They put me on a very, very strong drug to try and subside and help just the debilitating way of life every day. And it took 6 months for it to get into my body. And slowly but surely, the pain would be okay. And then when I'd have to take my medication, I knew it was time to take my meds. But the medication itself had so many side effects.
Yeah,
so
because
that's
it's
how
very heavy medication.
Yeah,
I
it's
know
a heavy
that, yeah.
medication. So that's how it started for me. The
And also
chronic
remember
pain.
that you are a hairdresser, so your job requires a lot of physical.
Yeah, I was going back to work and obviously having to put this brave face on that, you know, I was ready to go back, but inside I was in so much pain. And of course, standing all day didn't help. But then going home to a baby that I couldn't even rock my baby. I would have to sit on the floor and rock him to sleep. So that's how it all started.
Yeah.
And then I met Kat.
So, Kat, what was when you understand that maybe the BII was your situation? You came straight to me. You visit other plastic surgeons.
So I did a lot of research on the page. So this Facebook page, the Breast Implant Illness and Healing, it's called, right? Is so informative. And on that page, they have a list of the recommended surgeons. For Dubai, there was only 3 surgeons on it. Now there is only one, Dr. Matteo, and one of them retired, and one of them does not believe in breast implant illness at all. So I personally would not want someone operating on my body that completely hoo-hoos
Ignore,
it.
yes.
Yeah.
Yeah.
Like, so anyway, now Dr. Matteo is the only one on it that is skilled enough to do the full capsulectomy and remove all of the tissue, because a lot of women do report if some tissue is left in that they can still have the symptoms. Also, you need a surgeon that is skilled enough, like Dr. Vigo, that can remove it as a whole in case of any rupture, etc., etc. So when I met Dr. Vigo, I felt very, very confident. I also spoke to your previous clients that had done the same surgery. So I felt very, very confident and happy with my choice of going with you. Otherwise, I was going to fly to America and anyway.
No, I'm happy that
happy.
you found me and I was able to deliver what you were looking for. Another important topic is a very recent study that came out with, I think it was from Asia, where they did a study in patients who had a full capsulectomy or just the implant removal.
Right.
And they have seen, and this is scientifically proven, that there is no difference statistically in the remittance of the symptoms with the capsula in or with capsula out. So it's very important that, again, it's better if you can to remove everything.
Yeah.
Not leaving any scar tissue is always better for us. But in some particular case, for example, I had few patients where the implants are placed submuscular, which means that the posterior sheet of the capsula is against the rib cage. And it can be dangerous because under there is a lung. So if I'm not precise, I can do a serious damage to the patient. So in some cases, I need to leave the posterior patch of the capsula because I cannot remove it. It's too adhesive to the rib cage. So, and I've seen in these patients that the remittance of symptoms is complete in any case.
Wow.
So it's important also to deliver this message that if we can, yes, why not? Why we don't do the full capsulectomy, the en bloc removal? But in some other cases, if it's not possible, the symptoms can go away even with just implant, because implant is just a trigger. It's something that is there and continuously triggers your immune system and your body to respond and to create the symptoms that you just described. Yeah.
Can I just say though?
Yeah.
On the page, the surgeons that are all doing it in America that only do explants, that are really passionate about explanting, they say that there's always a way to scrape that off with a butter knife. So
It's a dangerous procedure.
yeah.
It can be done. And up to now, honestly speaking, the amount of patients where I had to leave a little patch of the capsule inside is very minimal. What I do, if I leave the capsule, I burn it completely.
Yeah.
So I remove the cells that can cause this kind of symptoms. So in any case, I do something. I don't leave the patch and that's it.
Yeah.
But again, this study where the patient was just operated, cut the breast, take the implants out and close. So they don't even do anything on the capsule itself. Meaning that the statistic proves that even leaving inside is not a big deal.
Yeah.
If we can move it better, but if we cannot for whatever reason, some patient, they said, just take them out. I don't want to do anything else. They don't want to, because sometimes after 14 years, after 9 years, the breast maybe is a little bit saggy.
Yeah.
Yours were both very high compared to the breast. The breast was, we had what is called waterfall deformity. So the implant is high and the breast slides down.
Yeah.
And if you just remove the implant, the result aesthetically is not nice.
Yeah.
So we had to do a little bit of a lifting to bring them back to their normal situation. Yeah. So
Funny, actually, isn't it? Because me and Katie's looked really
Very
similar,
similar.
right? But
Yeah.
yours were rock solid, weren't you, with the tissue?
Yeah, I
How much
remember
it
when you
built
said
up.
to me, so do your breasts feel hard or soft? And I was like, yeah, I think they feel soft.
and then I touched and I was like,
And then he was like, Katie, they're rock hard.
Yeah,
and it's
then
just what
touched
you're
them
used
and I
to,
was
isn't
like,
it?
FML, Katie,
Yeah.
they're like a brick.
Yeah, it's what you're used to. You don't know any different.
And that's important also to, with this kind of podcast,
Yeah.
to instruct the patient to understand their symptoms, okay?
Yeah.
Because sometimes, again, they don't think that the implant is right or wrong. Some patient comes
No.
and they're very hard and they're super soft. I said,
Yeah.
no, you feel the implant because it's an implant.
an
there,
implant.
But it's absolutely great. So it's important the patient, if they don't know, they consult with a plastic surgeon
Absolutely.
to understand if everything is good. And then there are, a lot of tests. You can do an MRI, you can do an ultrasound to
Yeah.
understand. Nowadays, how many women have breast implants? A lot. So even the radiologists, they know how to do a mammography, because everybody's scared, oh my God, the mammography, they will break the implant for the pressure. No, because they know how to deal with the pressure in this kind
Yeah.
of situation. So it's very important that women understand that there is a whole medical community around the breast implant. We're not doing anything which is unethical. I will not put an implant if I know that for sure will cause something. For example, there was many years ago this injection of hyaluronic acid in the breast. And everybody, back in Italy, it was 2010, 2008, and everybody was injecting this. And I did some surgery of a breast augmentation patient who had this, and you can see cyst, accumulation of this hyaluronic acid. In fact, now it's banned. I never did that. That was at the beginning of the study. I was not sure that he was sure, so I didn't start. Nowadays, it's completely forbidden. It's very important that, doctors follow the scientific proof that what is proven.
Yeah.
And implants are proven to be safe. They don't cause breast cancer. There are a lot of studies about that. So it's very important that people understand that I'm not doing anything which is unethical.
Of course.
And you understand this because
I've researched it myself. When I research and I talk to others in my circumstances, clients, I'm never going to be that person that would say, don't do it, because it's so individual to your genetics. And I would never sit there. I actually had a client the other week and she just had hers done. And I'm not going to sit there and go, oh, God, you're crazy to do it, because you're not. Everybody's body is different.
I had a patient a few years ago at a similar situation as yours, very hard waterfall deformity, etc. She came, she removed, super happy. She asked for the en bloc capsulectomy, so to remove everything. So she was very specific. And then she came back after a few years for the normal follow-up, super happy. I said, oh, I've seen the new technique you're doing with Mia. I would recommend my daughter to do it. So it's important that they understand that this is not the devil. That's something that absolutely is not recommended.
Yeah.
Some patient can have a reaction, but like if you do, hair
Anything.
coloring,
Yeah,
the hair
of
color can turn
course.
into another color because it's a reaction of the body of a patient to something, which of course is not natural, it's silicone. But is proven to be safe, especially there are different brands. Some brands have been removed by the market.
Yeah.
So you cannot find them anymore because they were causing a lot of problems.
It's the brand I had, the textured ones.
Exactly.
Yeah.
The macro textured one are not available anymore in the market because they don't want to go and see all the symptoms that a lot of women experience.
Yeah.
So with the implants I'm using now, I don't mention any brand at the moment, but I don't experience any capsular contracture.
Yeah.
So it means that these are safe implants. They can have other the problem linked to the technique to use, but this is a surgeon problem, let's say. If I know how to place them, they will have a very nice and natural result. Let's go back to the topic. Katie, emotionally, when you understood that, okay, this might be my problem, how can I solve it? How did you feel when you said, I might have found through Catriona the possibility to solve my issue?
Just a relief that maybe there was light at the end of the tunnel. And I just obviously had spoken to Kat about yourself. And I just couldn't wait to actually meet you and have the conversation and explain to you. And I suppose then when I met you, I felt so comfortable that you understood what I had been going through, that's when I made the decision that I was going to go ahead with it. Then expressing it to my husband and to, you know, my closest, nearest and dearest that had gone through my journey severely with me in the last year, that there might be light at the end of the tunnel, they were so excited.
Yeah, because also another important part that I try to put into my practice is the empathy with the patients. And you both experienced that, the fact that, again, it's not scientific proven. I'm a scientist at the end of the day. I'm a doctor, so I follow the science, but I also listen to the patient. And I don't think that a BII patient is a crazy patient with a psychologist. Tell me your symptoms. Let's try to understand. And if I see that this might be the problem, we go ahead. I can suggest you something else. There are some other treatments, maybe a fat grafting or something that can reduce some of the local symptoms and enhance the result, etc., which is less invasive. But it's important for me as a doctor to be empathic with my patients and to understand that, because otherwise I just do my job like a robot and I don't listen. That's a lot of, reviews on my website is about that. The fact that I give the space, I answer the question, and especially in your cases, you had a lot of questions. You came and said, what is this? What is that? What if I leave a piece of capsule? What if I don't do? What if the implant is broken? What if? And it's important that the patient feels comfortable. And that's why I also have a very high rate of conversion to my patient from the consultation to the surgery, because they feel comfortable. And it's about, we are all human beings.
Of course.
And I always tell even my team, Sarah, that you all know my assistant. Now there is a new doctor who joined my team. And I always tell them, put yourself in the shoes of the patient.
Yeah.
If you were the patient, what do you want to listen? What do you want to be? How do you want to be treated by the doctors in front of you? That is absolutely very, very important. So when you decided to go ahead, Catriona, with the explantation, how did you prepare? I don't remember these details, but how long did it take to you from the consultation to decide to go ahead with the surgery?
I think we booked in like ASAP. I think it was within like 2 weeks, because I was so made up in my mind after doing all of my research that this was the answer. And I just wanted them out like as soon as possible. So I think it was really fast. Yeah. I think you went on holiday or something and I was like, you need to come back now.
I'm not allowed to have holidays for my patients. When I go, why?
I'm the same.
Why are you not working on Christmas Day?
Yes, it was really fast for me, because once I'd been searching for so many years of my health, what was the answer? Why was I feeling like this? Why was I having so many problems? And then as soon as I really dived deep into that and typed in all of my symptoms and saw thousands, there's 200,000 women on this page. You type in a symptom and you get like 50 stories or more of all women having the exact same things. So my mind was made up and I wanted them out as quick as possible. Okay.
And Katie, what was the post-op period for you? So I remember you told me that from the day after you felt a new woman.
Oh my God. We were talking about it earlier. Tell us a little bit, because it is very important. Obviously, the day that I went into you, I literally was like, just do everything as you've said. And the next morning, I literally woke up and I remember Kat saying to me, just as I was going down, remember, this is going to be the last time that you breathe the way you do. You are going to breathe like a normal human after this operation. And the next day, I just remember being able to take a very, very deep breath in, because before my chest was so tight. And after the operation, within 4 days,
You looked like a different
I looked
human.
like a different person. I could see like life through different eyes. My eyes looked totally different. I was alert so quickly within 4 or 5 days. The brain fog had lifted. I was out for walks on Kite Beach and I didn't have pain in this left foot that I used to get, and I would have to take my trainer off after running after 20 minutes. So all these very small things I saw very quickly. And the pain was very minimal. Exactly like you said to me, Kate, you're not going to really be in pain. And for that, I was like, I'm fine. I can do this and I can do that. And it really was incredible. People have asked me, what was it like after? And it was just minimal pain for me. I literally took paracetamol. That was it.
Yeah. I also am very proud of my techniques in the sense that for me, plastic surgery should be pain-free. As much as we can. Of course, it's a surgery. We could expect a little bit of discomfort and pain. But when I hear stories of patients, I was in 1 week in bed, I could not move, I said, this should not be the situation. Also because what I try to do to respect the tissue where I'm doing a surgery. So I'm a very quick surgeon. Not because I'm less precise, less details, but because I believe that the less I traumatize the tissue, the faster the recovery, the less the pain is experienced by the patient, and the patient go back to their normal life and have a positive attitude towards the recovery. If the patient is in real pain, and we have different pain threshold, there are patients, you touch them, they cry for a week. Patient, you can go over with a car and they don't say anything. It's very different. But if the technique is solid, is proven, and is quick, I use very minimal. I don't know if I use drains in your case.
No, you did, but I didn't.
Okay.
Yeah.
You didn't, because it depends, of course, in the situation at the moment. But again, and you didn't need it. And your case was severe than her in terms of the capsula, the longer period that it was inside. But again, it went out so well that I didn't need to...
Yeah, I just remember a week later, literally putting high heels on. I was going out for lunch with my husband to celebrate, and I literally bounced through your door, literally with a pair of heels on, because before that I could never wear heels for less than 10 minutes. And I was always a woman in heels, at work even back in the day. And just within a week, you literally changed my life.
That's
literally.
Really, for me, is the best message.
I literally feel grateful every single day. I feel blessed and thankful that you put me onto you. And you did such an amazing job.
Thank you. I'm very happy. This is my reward to help people, not only to enhance their beauty, but enhance also their health.
Of course.
Because it's very important. There are links. Again, I'm a doctor, so I work in different...
and I think your beauty, you can be beautiful, but if you're suffering in pain, like I've never had so many comments on people saying on my Instagram, oh my God, you look so amazing. What have you done? And I'm like, I'm well again. I'm healthy.
Your transformation was huge.
It's huge. I look at myself a year ago, like my body's half my size now. I couldn't lose weight. I was training all the time.
It was your face as well.
My face was
so inflamed.
Swollen, I remember.
And then
swollen with these big puffy lines. And
you look like a different person.
People are like, what have you done? I'm like, I've just had a very severe illness and I've had the operation to help it. So, you know.
Very important. And in both cases, have you experienced any symptoms left after the procedure, or everything completely gone?
For me, everything is gone. It's crazy. I was like writing them down the other day and I was like, it was even little things, like I used to have like reoccurring infections, like styes, like always sick, like I haven't been sick since I had them out. Like they came out of my body and I felt like a new woman.
Amazing.
Straight away. And the inflammation, like even like food intolerances and food allergies, my gut health, like everything has improved for me. Like my body really did not like those.
But it's very important. Also, the other thing that I tell the patient is because they come and said, oh, when do I have to be changed? Okay. There is no rule about that. Again, I remove implants after 25 years just because the sagginess and the gravity will still work on them. So the aesthetic appearance of the breast was not nice. So they wanted to replace them or remove and just lift them because maybe they are in their 60, they don't care about the bigger breast. But implants were fine. The patient didn't have any symptoms. The patient were absolutely fine. So it's important to check them. I always tell, is the high quality medical silicone, but it's a piece of plastic. So if I rub on a piece of plastic for 10, 15 years, of course it might be damaged and need to be changed, but doesn't need this kind of fixed time where it has to be changed. A lot of doctors say, oh, after 10 years you need to change them. No, I tell you, you need to check them. Check them. If they're fine and you're happy with the result, why you have to change it? Why you have to go under the knife again if it's not needed? So I'm also very conscious about the need of a surgery.
Yeah, one of my girlfriends, she's had hers in over 20 years and she still doesn't have any issues at all
some
for
women
her.
suffer with nothing. Like, you know, there's thousands of women that have them and feel absolutely fine. But it's interesting as well, the genetics, like on the page they talk about the genetics of certain genes that you can have that is more likely that your body will reject them. So that's something to look into. I think if you're considering implants and you're worried about this, you can do that genetic testing and see whether it's more likely that your body could reject them.
Yeah. Again, important to deliver the right message that these genes have been associated with that, but not scientifically proved that they are exactly the genes that are responsible for the BII. So that's also very important. You can do this test, but maybe they say no, and then you have the BII, or they say yes, and then you don't develop it. So it's absolutely personalized, this thing. Another important, how soon after you had your breast done at the beginning, you developed the symptoms?
So I think for me, it was looking back, things started to change for me within about a year, but it was livable with, but I just knew something wasn't quite right. And I was doing, like, I'm very healthy. So I was doing all of the things that I could do to feel good, but not really feeling good. But when my symptoms went out of control was after I gave birth. Like that was when...
You breastfeed your baby?
Yeah.
For how long?
It was about a year.
A year. And you?
6 weeks, and then that was it.
But my symptoms went crazy after having her. Like it was, I couldn't live in my body anymore.
And for you was the same?
Yeah, exactly the same. My pregnancy was quite tough, I must say. But in terms of me having them put in, I can't actually say that I saw a dramatic change. It was literally when I fell pregnant for me. I had sciatica, but that was just, I put it down to training, you know, running a lot. But for me, the triggers started through the pregnancy. I was really suffering with all different types of symptoms with my body. But afterwards, after the breastfeeding, boom, that's when it all heightened.
Because also the breastfeeding is a lot of stress on the breast tissue. And of course, there is the implant. It's absolutely safe to breastfeed with a breast implant.
I was going to say, do you recommend, because that was a big thing for me. It wasn't something I personally really wanted to do, but if I could do it and it worked and he latched on, then great. But a lot of people, it was a big question for me before I had the baby. Can I breastfeed? Can I not with implants? Like,
absolutely,
you can,
you can breastfeed. Is not a problem. Of course, there is a slight chance that your breast doesn't develop enough milk to do this, but I always made the example of my kids because in the first pregnancy, my wife was giving the milk to the neighbors because she had milk so much. She was pumping it out so much. She breastfed for 6 months non-stop, and the second baby, 2 weeks, 3 weeks, and then so the same woman, same, it changed completely. So even from one pregnancy to the other can change a lot. Having a breast implant is not absolutely a no-go for the breastfeeding. You can go do the breastfeeding and you can absolutely have it's safe done. People think, oh, but the baby will drink the silicone. No, of course, the implant is intact. The silicone is not, and doesn't affect any kind of problem, give any kind of problem to the baby itself. So it's absolutely safe. But again, if you have a problem, if you have a capsular contracture, the change on the breast, the tension on the breast can enhance the capsular contracture, the problem with the implant, and the other symptoms that you were experiencing. So I think for both of you, the pregnancy triggered even more what was lying down a little bit under the carpet, and then boom, it flourished with the pregnancy. Which is, from a certain point of view, a blessing, because then it is the moment to say, okay, I need to do something. Because maybe if you didn't have this sudden
it
change,
would still be lying dormant almost, right?
Because again, you thought they were softer, so you didn't know that was the problem.
And it's funny because I told a girlfriend recently before I had the op, saying I'm actually going in, and we used to work together, and she was like, oh my God, you always used to say, like, feel my boobs, they're so hard, and I was like, did I? But you just forget these things, don't you?
That is her tissue buildup. That is a sign that there was something wrong, right? That hers was so hard, because that shows that she's got a really thick buildup of tissue where her body's trying to protect her from this.
Exactly.
And when you got them out, the video I've seen is, I said to Katie she should share that, because it's quite brutal, and her tissue was very angry looking, like very thick.
It was very, very thick. It's and I always do this video at the end just to...
it's amazing to see.
I cannot post that much on my Instagram because it's a little bit borderline for what I'm posting. Some patient can be, scared to see these things, but it's important to understand really the capsule, how thick and the inside, how calcified it was, hard, and which from a surgical point of view is much better for me, because if the capsule is very thin, it's difficult to remove it completely. If it's thick, for me, it's easy to go around and remove it in one block like I did for you. So it was hard on you. It was easier for me when I did the procedure. So it's much better. We talk about this Facebook group. So tell me, you said that your friend introduced you to this Facebook group. Tell me a little bit more about the Facebook group. What are they saying on this Facebook group? Because I cannot enter, of course. I don't know anything about that.
Maybe you could. Anyway, so there's like, what was it, 200,000 women in it?
Started off with just a few women.
All
over the world.
There's one for the UK, and then there's one that I'm in both of them. But it's all just women talking about their symptoms. We post pictures of the explant, which is what you provided us to show that you've got the tissue out intact, and that's how they qualify surgeons to be on the list. So Dr. Matteo is the only surgeon on the list for Dubai now for a proper explant. They're very strict about how you do it and the rules and how it looks afterwards, having the pictures as evidence that you've got all of the stuff out. But it's just loads of women just writing their symptoms, writing their stories, and
encouraging women as well.
It was like, I honestly spent one night on the page, and I was like, I need these out.
And what are the questions? What are the worries that they have about the surgery, maybe? Because, they maybe understand that they have the BII, but what is the worry about the surgery? What
they all discuss the surgeons, like whether they've completely removed the tissue, like how the aftercare was, whether they believe in BII, breast implant illness.
I think a lot of it as well for women that are looking at themselves. How are they going to feel? How did you feel? How are you feeling about what you're going to look like?
How do you feel? Like people that did lifts, people that didn't do lifts. Like, I mean, I felt so bad in my body for so long. I was like, I'm not going to take these out and have flappy bags of skin, I want to look good. So that's why I could see that you were a perfectionist as well, and I'm a perfectionist, and I wanted them to look perfect.
But that is a lot of questions that people talk about. For me,
people don't need the lift.
No,
we definitely.
A lot of people I recommend having the lift. For me, when I was putting methotrexate because it was the drug that I was on, and I wanted to hear what other people were using, and that kept coming up, and they were talking a lot about their side effects from that.
Rheumatoid, to add, sorry, Katie, rheumatoid arthritis is a common symptom on the page. So that's why
exactly the same feeling, because I was trying to explain it to my mum or dad, and it's like literally this awful stabbing pain that you feel like is coming out of your legs, and someone else said that, and I was like, oh my God,
it's an
exactly
inflammatory
the same
condition, which is what you were,
Yeah,
extremely
inflamed.
inflamed everywhere.
And what came with that was depression. I'm a very positive, upbeat person. I always have been, and to then have the depression, that obviously when I was reading, that comes with it. It's an inflammation. So it's just very interesting, the Facebook, and actually to encourage you to make sure actually this is my symptoms, or actually I don't think this is.
Yeah.
Because
There's a lot of interactions with the other women.
and you can talk to people.
They empower the others.
Yeah, they
teach
encourage in a
from-
positive way for you to say, actually, this is it, or actually, no, this is definitely not me.
Okay.
But thank you. I'm glad I looked at it.
It's important to say as well, Katie, that you have come off your medication
Yeah.
since, and you haven't had any pain, which is the
No,
biggest.
I've been off of it 4 months now. And
That was my best reward when
yeah.
you told me I'm off the
Incredible.
methotrexate.
Yeah.
I said, "Oh, that's
Yeah.
because it's a very heavy medication. It's a
Yeah.
chemotherapy, so we use against cancer.
Yeah.
So I know that it's very, very heavy, and knowing
yeah,
that
I was very nervous because talking to the doctor, it can take 3 months to really come out of your body. I'm still very much in the detoxing scenario going on. I've just done like a organic cleanse last week, and I'm very cautious. I still don't eat meat because it's such an inflammation. But yeah, I haven't been on methotrexate now for 4 months.
That's good.
And it's just incredible. And now I've actually come off my antidepressants, which I'm just so pleased about, because it's something that I wanted to eventually come off. And yeah,
I'm so proud of you, Katie.
thank you. Thank you.
It's just, such an amazing
Yeah.
story.
what is in this Facebook group? What is the nationality that they are interacting? You said that there is
all different. It's women all around the world, but a lot of them are based in America. where explanting is extremely big in America.
Okay.
There is a lot of surgeons that are only doing explants, and that's why a lot of people travel over there to.
I want to add one thing. It's very important. All the implants that are proven in the US are FDA approved, which means that they go to a 10 years trials to be approved from the FDA. We don't have it here. We don't have it in Europe. The CE market, for example, is much easier. They had for many years only old implants, which are the most responsible for this kind of symptoms. The new implant had just been approved last December. And the moment they entered the market, they sold, I think, 500,000 pair of implants in like 1 month. Because all the doctors were waiting for this new implant that are all around the world, but FDA takes so long to get the approval for them. And so why the market of the explantation is so big there? Because they have old implants that are most responsible for these things. Because as we said at the beginning, the macro-textured implants are the one most responsible for this BII, because they have a lot of higher capsular contracture. They are responsible for the ALCL, which is a lymphoma linked to the breast implant, but only for those implants. And in fact, some of them has been completely removed from the market.
Which is the ones that I didn't know that I had until we took them out, because I couldn't find the card.
Yeah, the
I had
card.
the Allergan ones that were textured that were recalled. So when I got them out, it was almost like peace of mind as well. Like, you're not crazy. Obviously, your body didn't like
exactly.
these implants.
So
they
it's
don't
very,
make them anymore.
very important
you know?
also the kind of implant that the surgeon choose at the first
Absolutely,
page. And I'm working with the implant I'm using now since 8 years. And honestly, I didn't have any kind of problem. I had problem, again, as I was saying at the beginning, my technique has been to be adapted to the implants, because they move in the breast in another way compared to the old ones.
Right.
Now that I know, I put the implants and they're absolutely fine. So it's very, very important also when you choose a doctor from your surgery that you understand why is choosing those implants, what are the benefits of these implants, and what is the possible outcome for these implants. So I think we covered all the topics. I'm really thankful for this chat because you've been so precise and detailed. What would you leave as a last message to the patient who experience symptoms like that?
join the page. It's a Facebook page. Do your research. You know, type in your symptoms. I think women, we're very intuitive, right? So we know when something's not right in your body. Listen to that voice. Like I could hear my body screaming at me for those years. We started off with a whisper and became a scream. And honestly, it was the best life decision I've ever made, was getting them out. Like, I feel like a completely different person, and I am so grateful. So grateful. We are both so grateful.
Thank you so much.
Yeah.
I think you can share the same thoughts, right?
Yeah,
about that.
exactly the same. You know, just don't hesitate. Go with your gut feeling of what your body is telling you, because you're not going crazy. And for us, I think, depending on your age, you know, people have had children and then they think it's money, you know, I'm just starting the menopause. But actually, just do your research and go to a surgeon that you believe in, which is so important, because I was sitting there and when I met you, you know, we aligned in energies and I believed in you and you believed in me. And that is so, so important, that you actually go with the surgeon that you connect with.
Exactly, because I always tell the patient,
for you as well, you know,
I'm not doing a surgeries on a piece of wood.
Exactly.
And there should be a connection. We should be aligned. We should be looking at the same goal, which is beauty enhancement. It could be health issues. It could be whatever. And we should be aligned. If we are not aligned, I said, listen, go to somebody else, you know. If the patient comes and said, I want a crazy result, the eyes like
you
this.
don't work like that.
I said, no, it's not me, you know. So we need to be aligned. If you're not aligned, I know they're not delivering what you want. You will not be happy. Prefer, you know, walk away.
Absolutely.
There are a lot of other surgeons happy to, you know, support in what is your decision. Go ahead. I'm not following for this. Yeah, absolutely.
Amazing.
Once again, thank you so much.
Thank you for having us. It's been
really,
a real pleasure, hasn't it?
Yes, absolutely. So we will share this podcast with different reels. I have already some ideas on some sentences that you said that are very powerful. So I will use them to transmit the message. I'm also in the next month a speaker in the Dubai Plastic Surgery Society conference, and I'm talking about BII. So I will bring your videos. I will cut this part to show them, to see also, to share with the colleagues that maybe don't believe in that. This is the real story. So please believe that, because there is something that needs to be heard from the patient. And don't think that we hold the science in our hands. We are human beings. We follow the science, but we need to listen to our patients. That's very important. Thank you again.
Thank you.
To all my followers, thank you so much. I hope you enjoyed the episode. Stay tuned. Please click the follow button below, subscribe, and I'll see you in the next episode. Thank you. Because you deserve the best.